So let's start with the clinical example. So I have 4 examples. That's the first one. It's a head and neck treatment. Okay, a head and neck squamous cell carcinoma treated by 60 grays in 33 fractions, with an integrated boost. So it's VMAT treatment with 2 full arcs. We use daily IGRT with only 2 orthogonal KV images. And for the positioning, we use the 5 points head, neck, and shoulder mask. The problem with this case is that the patient was very stressed during the acquisition of the planning CT, and her shoulders were very tense. But in contrast, when we wanted to treat her, she was very relaxed and the shoulder positioning was not the same. That is the analysis with Adaptivo at the first fraction on the left. So it was not okay. You have the gamma pass rates here for each arc, and it was not okay even with higher criteria of 5%, 3 millimeters. And on the right, you have our daily IGRT KV image, and you can clearly see that the shoulder, the clavicle positioning is actually not correct. We did not see it because I think that our therapist was focusing on the spine positioning. So we did the treatment. It was not okay, so we programmed a second acquisition at the second fraction, and still it was not okay because of the clavicle positioning. Then we tried to work on that and correct the position in the treatment at the third fraction. So here you can see that the clavicle positioning is better and the gamma index was correct, more than 95%. So it was okay, but you can still see some hot points here behind the shoulders because we could improve the shoulder positioning, and that's what we did at the fourth fraction that you can see here, where the clavicle positioning is correct, and you can see that the gamma index is the gamma map are almost perfect. So I think that while we were focusing on the spine positioning, perhaps we wouldn't have seen that without the transit dosimetry analysis.